Dear Chairman, Professor Koch, dear ladies and gentlemen, and dear colleagues connected online, thank you for being with us. It's a bit late, and we have a very interesting topic to discuss and present regarding new products that can actually prevent and manage kidney stone disease. It's very important for us that we are surgeons to be able to give appropriate advice to our patients so that they won't have stone recurrence. We don't treat the stone, we treat the patient. So it's crucial to know that 30% of patients will recur. And that means that during our follow-up, that should be done frequently, we need to give not only advice to drink a lot of fluid, not to have a high salt intake, but we need to give specific supplements in order to prevent the stone formation and the increase of the diameter of the stones. So the kidney stone disease, as we say, the KSD abbreviation is of great interest because we have a high annual incidence. So we have new cases and we have a high prevalence. The problem is that we have many innovations regarding operation and treatment, but we don't have many innovations regarding prevention. And as we all know, preventing medicine is the most important topic. So a new concept is to actually interfere in two plans of our stone parameters. One is the composition of the urine. If we have the calcium oxalate stone, which is more frequent, an infectious stone like the struvite, or a uric acid stone. So this is one parameter. And the other parameter is that we have the pH of the urine. So we can interfere also in the pH of the urine. So if we think in these two different directions and we combine them, we may have products that can actually help prevent recurrence and actually treat some types of stones. And this has come out of basic science and out of many years of studies that have demonstrated that we have supersaturated urine regarding the uric acid stones when the pH is acidic, when it's below 5.5. We have, on the contrary, supersaturated urine regarding the infectious struvite stones when the pH is above 6.2. So in these two types of stone, if we actually interfere in these two different ranges of the pH and we actually turn them around, we can have a good treatment and a good intervention. Regarding the calcium oxalate stone, we always have a supersaturated urine, so it's something that you cannot change by interfering in the pH. But for uric acid stones and infectious stones, this protective zone 5.5 to 6.2, it's quite important. And why is this important for the calcium oxalate stones? Because many times we may have the inner part of the stone, the nucleus of the stone, being of a part of uric acid or a part of struvite. And we know that stones are heterogenic. So we may have a mixture of composition. And if this begins with uric acid or struvite components, then we're going to have a good way to interfere. So this is the whole concept to have intervention in modulating the urine pH, so modulating supersaturation, and also modulating the known theory of crystal nucleation, growth aggregation, by actually adding crystal inhibitors. So by these two different directions, we can actually interfere into the stone formation. So Devicare, which is a Spanish company, and we have the pleasure and the honor to have the CEO talking after my lecture and Professor Galland's lecture, has actually produced many years now in Spain and has circulated in 15 countries all around the world, 3 different products that actually follow these two directions of intervention. And for the non-calcious stone, which are the easiest stones to treat, but not all of us treat them, we have the mylit-Control pH up, so we are alkalizing the urine and giving inhibitors. pH down for acidification of the infectious stones, so this is roughly 20% of the stone patients that we treat, and also the mylit-Control pH balance for the majority of the calcium stones. So we have 3 products in these 2 directions. As I told you before, we are modulating the pH, and it's crucial to be able to monitor the pH exactly. And this company actually has produced the mylit-Control pH meter. It's patented, and it gives you the opportunity to measure quickly at home the pH as in the lab. So it's very important to have the device with you, and you'll see also by the CEO of the company the presentation of an application. So it's good to have more and more products. For the pH balance, the mylit-Control, as I told you, it's a product that inhibits calcium-based stones without changing the urine pH, because in this type of stone, by changing the urine pH, you won't have the result that you have with other types of stones. And as inhibitors, we have phytate, and also we have, So we have the phytate, which is known many years now, decades, that it's a very well-known inhibitor of a calcium-based stone formation, and magnesium, which we all know it's a very known inhibitor. So the combination of these 2 inhibitors is recommended daily, 2 capsules, and it's given for prevention of this very common type of stones. And there are impressive studies that actually have demonstrated that the dose of phytate, as you can see here, 120 per day, is equally to this huge dose of citrates, because we're used only to citrates as a basic knowledge regarding preventive and intervention for stone formers. And as you can see, with phytate, you need 55 times less dosage in comparison with citrate. And you can see how less how less are the crystals with the combination of magnesium and phytate in comparison with these big crystals without the presence of inhibitors. For the uric acid stones, as I said before, we have the mylit-Control pH up. Again, a good dosology and compliance regarding other alkalizers of the market. Here we have the potassium magnesium citrate, which is we all know it's a good alkalizer, but in addition we have also theobromine, which again from many studies has proven as a very effective inhibitor. And again the doses for prevention is chronic. 3 to 6 months are enough for dissolution, and we can increase the doses from 2 to 4 capsules for dissolution also. So these are things that have been clinically proven. And again, quite amazing images where we can see the addition of theobromide, how less crystals we've got. And again, the graphics. And the last is the acidification with the pH down for struvate stones. They are very dangerous stones. We all know that infectious stones can lead up to urosepsis. So it's quite crucial to prevent them and interfere with stone formation. So in this case, we have L-methionine, which we all know from the guidelines. And phytate has been proven in studies that it's a very strong inhibitor of the stone formation. And this is from basic science, and it has to do with the ions and other details that I don't want to tire you with. Again, chronic for prevention, 2 capsules per day. And from our clinical practice, patients are compliant with these schemes because they want something that will protect them. So methionine is well known, but we are not very familiar with the doses in other products. With this product, we are quite happy. And we are quite happy even because we have many studies with these products. We have over 40 clinical trials and 20 case reports, and we need evidence to prove the efficacy of these products. And this is necessary not only for arguing the pros and cons, but also to persuade urologists and persuade our patients to actually take these over-the-counter products. So to summarize, these 3 products are quite precise in interfering with the 3 different stone types. By combining modulation of the pH and by addition of specific inhibitors that have been proven in studies that will interfere with stone formation. Again, the pH balance with the phytate, mylit-Control up with theobromide, and mylit-Control down with methionine and phytate. And there are case studies that you can find in Devicare's website, and impressive images like this X-ray from a distal RTA case where you can see at the left side the amazing results. So an international distribution of the collaboration of Devicare, all range of products for all different stone formers. So I'd like to thank you for your kind attention and take the opportunity to have Professor Cox input regarding this concept. Please.
Thank you very much. Good evening, dear colleagues. First, I'd like to thank all the 3 ESD chairmen for their kind invitation. Also, Dr. Koch for chairing this session, and Devicare for thinking of me to give this talk about new medical device to monitor the urine pH in stone formers. As you know, it's already been told, around 80% of the stones are calcium-based, so the rest, 20%, are non-calcium-based, and they include struvite, uric acid, and cystine stones. And we also know that there are different situations depending on the promoters and inhibitors leading to these stones. In fact, a kidney stone would be the result of a balance between these promoters and inhibitors, which will determine the urine composition, but 2 other factors are needed for a stone to form, and these are pH and time. You have already seen a similar slide before, but I don't care talking about it again because I think it's the most important slide of our presentations, I would say, is to to reinforce the idea that urine pH is a key factor for stone formation. We know that urine calcium phosphate supersaturation quickly increases at pH higher than 6.2. On the other hand, acid urine pH is the most important factor for uric acid stone formation. In what we could call the protective zone, that is pH in between 5.5 and 6.2, and when we are in supersaturation conditions, the calcium oxalate, both mono and dihydrate stones can form. Normally by heterogeneous nucleation, the initial core of the stone being either uric acid or calcium phosphate, depending if the pH is nearer to one or another pH stream levels. The importance of the urine pH and its influence on different stone compositions has been well studied. In example, this report from Grasses and co-workers back in 10 years ago, they found that alkaline pH in stones containing hydroxyapatite, calcium oxalate dihydrate, and struvite. Meanwhile, calcium oxalate monohydrate and uric acid stones are found to be related with acid pH. They get to the conclusion that heterogeneous nucleation explains calcium oxalate monohydrate on uric acid at pH less than 5.5. It also explains calcium oxalate dihydrate on hydroxyapatite at pH more than 6. Struvite stones are found when pH is over 6, a little higher. And calcium oxalate monohydrate papillary calculi are independent of pH. So the main conclusion of this study is that an accurate pH determination is very important, and we can accomplish that with mylit-Control pH method. The fact that some stones with calcium oxalate monohydrate papillary stones are independent of pH could be in line of the conclusions from Wagner and Mohebi that with the so-called idiopathic hypercalciuria do not display problems in local or systemic pH regulation. Here you have two graphics on the relative effects of urine pH and total uric acid on undissociated uric acid. The dashed line denotes the solubility of uric acid. If you can see, at pH 6.5, even a high level of uricosuria does not significantly elevate undissociated uric acid. On the other hand, at pH 5.5, even a modest concentration of uric acid within the clinical normal range will lead to an undissociated uric acid level that will exceed the solubility. Also, we have diurnal variation of pH and volume. In the early hours of morning, both urine pH and volume are lowest, rendering this a particular vulnerable period for uric acid precipitation. The same example for solubility of cysteine. We can see that its solubility depends on urine pH. The higher the pH, the more soluble the cysteine is. But when talking about urine pH, a critical point is how we determine it. Should we still keep on using the strips to test the pH? Well, we know that lipstick pH measurement is not reliable for guiding clinical decision making, as they carry around 25% risk of producing clinically significant differences from meter values. And we also know that strips also tend to over and underestimate the true pH at high and low urine pH, respectively. We know that dipsticks pH lacks the precision required to guide medical management of stones, and that they lack the accuracy and does not allow to use them in clinical practice to alkalinize or acidify the urine as a prophylactic measure. Grasses and co-workers, again, in this study, found that changes when compared to the gold standard were 0.4 units. Meanwhile, those from the electrochemical sensor were 0.1, concluding that the new pH meter, was the mylit-Control, was reliable, accurate, and is for the patients to handle. Here you have a video on how it works. After pushing once, you see the last pH determination, and the first step will be on the solution buffer, just to set the pH meter, a calibration. Then we change the tape and put it on the urine sample. And just by pressing once the button, in a few seconds we will have an accurate pH determination of that sample. So it's quite easy for the patient to handle, as you can see. The Koenig and co-workers evaluated in 2018 several methods for pH measurement comparing to the gold standard, which is the professional lab pH meter. They reached the conclusion that mylit-Control portable electronic pH meter was a reliable pH measuring device. Another important issue is the effect that time and temperature and also stand composition have on the pH. Time and temperature are variables we can forget about when using the mylit-Control pH meter, as it can be self-determined by the patient immediately. So time and temperature will not be an issue anymore. Regarding composition, we know that the levels of recommended pH will differ according to the objective of preventing or treating the already formed stones. Here again, it is critical an accurate pH measurement, which can be obtained by using the mylit-Control pH meter. So, in conclusions for this first part of the talk, we can say that urine pH is clearly associated with urinary stone formation. It works for all types of lithiasis. There's an optimal level of pH according to type of lithiasis, and mylit-Control pH meter is the best tool to control the urine pH of stone formers. So let me please start with what we call PREVENT-LIT study. That was a study that was designed in order to evaluate the utility of mylit-Control pH meter and lithiasis patients management with nutraceutical manipulation of pH. 17 different centers in Spain gathered 143 patients who were followed up for 3 months. We conformed 2 groups. The first one, 78 patients from the acidifier group. They were patients with history of calcium stones and a pH at baseline over 6.2. We call that the acidifier group, and they were prescribed 2 capsules a day of mylit-Control pH down, composed of L-methionine and phytate, as you saw previously. The other group, 65 patients with history of uric acid lithiasis and pH at baseline less than 5.5, conformed the alkalizer group. They were prescribed 2 capsules a day of mylit-Control pH up. That is composed of potassium magnesium citrate and theobromine, an inhibitor of uric acid crystallization. In the global study population features, mean urine pH in the acidifier and alkalizer groups were 6.75 and 5.1 respectively. And most of them, as you can see, over 90% in each group, were recurrent stone formers. And 1/3 of the patients with uric acid stones had been under previous pH control therapy. Both nutraceuticals in the results were significantly effective in normalizing pH at all follow-up visits when we compared with the baseline. It was more evident in the alkalizer group, with a maximum percentage of patients achieving non-litogenic pH at day 60. You can see in these graphics that both mylit-Control pH up and pH down proved to be effective at regulating pH, with significant changes at 1, 2, and 3 months of treatment when compared to basal level. And most importantly, it was an effect sustained over time. Analysis of the effect of treatment compliance at 60 days indicated that 72% of compliant and 46% of non-compliant patients achieved non-litogenic pH. For those compliants, up to 75% of the patients in the alkalizer group, which were described mylit-Control pH up, reached non-litogenic pH values at 60 days. Moreover, a causal regression model indicated that non-litogenic pH at 90 days and compliance at 60 days were independently associated with colic complaints-free survival. So that means that the probability of new stone events dropped more than twice. Regarding satisfaction of the investigators with these products, the control pH up and pH down, it was good or very good in more than 80% of the cases, with a reported tolerance about 90%, whereas adverse effects, all of them minor, gastrointestinal and minor, were registered in less than 9% of the patients. So we can conclude that urine pH is a key factor in stone formation. The pH determination should be performed with a pH meter. Nutraceutics are useful at regulating urine pH, and mylit-Control can decrease the probability of new stone events. Thank you very much for your attention.
It's my pleasure to be here in the wonderful city of Athens, learning with all of you and from all of you about kidney stones disease in this event. I am the founder and the Chief Executive Officer of DeviCare. My name is Rosendo Garganta. And first of all, I would like to introduce DeviCare very briefly. DeviCare is a specialty biotech company dedicated to developing innovative medical treatments in urology and exclusively in urology. You can see here our wonderful building that is near to the Faculty of Medicine of the University of Barcelona. DeviCare is investigating, together with the University of Balearic Islands, on the discovery of new molecules, new mechanism of actions, and new digital technologies to prevent the kidney stones disease. And the DeviCare's products for kidney stones disease, the mylit-Control family that you have seen before, are protected today by more than 35 international patents, and they are clinically validated by more than 40 publications and commercialized in more than 50 countries around the world, including Greece, thanks to our colleagues of MedPrisma. These products, again, the mylit-Control family, today represent the most complete and comprehensive solution for kidney stone disease. As you have seen during the presentation, during the symposium, they are composed by 3 oral therapies, one intended for uric acid stones, another one for struvite stones, and another one for calcium-based stones. We are still working to develop a specific product for cystine stones. Together with these 3 oral products, we have one medical device in order to monitor the level of urine pH with reliability and with accuracy for stone-formed patients. And now, very recently, we are launching a new revolutionary mobile medical application in order to ease the follow-up of the patients and in order to increase their patient compliance, their adherence. So, but why we decided to develop mylit-Control, that is the name of the mobile medical application? We did it because we realized that there are at least 2 big major problems pending to be solved in the prevention of kidney stones disease. The first problem is related to the burden of the disease. That is caused because, as we have seen before, it's a disease that is increasing in terms of prevalence, annual incidence, recurrence, economic impact, despite of all the technological advances in interventional procedures. It is a disease that has a lack of effective medical treatments and a lack of preventive measures in order to reduce the burden, and it's a disease that is highly correlated with current unhealthy lifestyle and unhealthy nutrition habits in our society today that worsen the situation. The second major problem is related to the patient's compliance. This is because patients are not aware of the risks of kidney stones disease. Patients don't have the proper education and information about how to deal with the disease and how to prevent new episodes. Patients do not receive proper follow-up by their doctors, and there are other causes, as we can see here in this picture from Dr. Golom et al. In 2019, that also alterate the adherence of these patients. So mylit-Control application aims to contribute to the prevention of kidney stone disease by reducing the burden and by increasing the patient compliance. How do we do it? First, with a first section, that is the section, you can see here maybe with these are the sections, okay? So we have first section for monitoring key parameters in kidney stones disease. One of the parameters is the fluid intake, another one urinary pH, and then the oral treatment. The second section is intended to raise the awareness about the disease with clinically validated content, very simple for the patient, with information and education about kidney stones, stones type, medical management, surgical management, lifestyle recommendations, nutrition habits, the importance of urine pH, and much more information in a very simple language for the patients. The third section is very important. It's a section intended to monitor the progress and try to change the behaviors of the patients. And we do that showing them the results and the points, healthy points, that they are obtaining by having a good behavior and having a good adherence. We have also a number of challenges in order that they can obtain more points, okay? And we have also a number of rewards that they can get if they have a certain amount of points. For example, a potential reward can be a discount purchasing our products, okay? The fourth section is a purchase section. In the application, the patient can find all what they need, every mylit-Control pH product, mylit-Control pH meter, the balance, the down, in a very simple way, only clicking a button to buy the product and receiving the product at home. So it simplifies a lot the process for the patient in order to buy the products. In addition to this full section, mylit-Control application may be synchronized via Bluetooth with the mylit-Control pH meter, with the medical device, in order to upload the urinary pH values automatically, very easily, in seconds. And the application, it also sends smart notifications and smart reminders using intelligent algorithms to increase the adherence of the patient for any of the monitoring parameters. So in conclusion, mylit-Control application is a revolutionary solution recommended for stone-formed patients that is completely free. It's completely free for the patient, with Bluetooth synchronizations to connect devices like the urine pH monitor, but why not? Also smart watches, also smart scales, smart bottles, wherever you think that we can connect to the application in order to monitor parameters of the patients. It is a GDPR compliant, and it also provides tons of data, tons of hundreds of thousands of tens of thousands of patients using our application every day for those researchers interested in clinical research, interested in studies, interested in to make publications. So, for instance, in this first publication, we evaluated the influence of the nutritional composition on the diurnal variation of the urine pH. For the first time ever, we measured the diurnal variation of the urine pH of all the micturitions of a young, healthy man with 21 years old under different diets during a period of 4 weeks. Week 1, baseline. Week 2, acidic diet. Week 3, a basic diet. And week 4, a DASH diet. So we demonstrated with this study that the diet plays a significant role in the diurnal variation of the urine pH and in the daily urine volume excreted, which plays a key role in the kidney stone prevention also. We also demonstrated, and this is very important, that the diurnal variation of the urine pH provides much more detailed information than the 24 hours urine pH test. And we opened, in my opinion, a new field of research based on the characterization or the diurnal variation of the urine pH and its impact in urological diseases like the kidney stones disease, but also the urinary tract infection, the bladder cancer, the urinary incontinence, and so on. So for the first time, we can see how these diseases affect the urinary pH during the day, and also we can see how, for example, using a double J stent or a bladder catheter or an antibiotic can impact the urinary pH values. So in this second study, we evaluated the usability of mylit-Control application with 21 healthy subjects of both genders between 26 and 61 years old, measuring and uploading the urine pH values 3 times per day during 2 weeks. We demonstrated with this study that the mobile medical application was easy to use for all the participants with an average adherence of 70%. Adherence of monitoring and uploading the urine pH values 3 times per day. And finally, in this third study, we evaluated the usefulness and acceptability of mylit-Control application in 37 kidney stone former patients with different types of kidney stones except cystine from Spain, from different centers of Spain. And we demonstrated that the patients increase, we are talking now about patients, they increased their adherence using a mobile application by an 87%, compared with less than 50% in the study of Dr. Golom and colleagues. And we also demonstrated, and this is also very important in my opinion, that patients really want to be empowered, as it was demonstrated by the fact that 81% of the patients continued using the applications after the study. And by the fact that they scored with a grade of 8.2 out of 10, the probability to recommend the application to other patients. So at DeviCare, we are convinced that the best ways to raise awareness about the medical community, about the importance of using these digital technologies in order to prevent the kidney stones disease is through clinical research, and by disseminating the results in events like this one. And this is why I personally would like to encourage the guys that you are here today, and maybe the guys that are listening online, to participate with us in making these studies, in making publications. And if you do that, if you are interested, if you are really interested, you are going to have access, free access, to tons of data to analyze, to review, and to publicate. Here you can find some ideas of studies. We can make studies of characterization of the diurnal variation of pH in different pathologies and under different treatment regimens. We can study the adherence of the patients to fluid intake, urinary pH monitoring, oral treatments, and maybe other measures that you want to implement in the application in the future. This is amazing. We can make studies of quality of life using clinically validated questionnaires through the app, sending them immediately, automatically, to thousands of patients, motivate them to answer these questionnaires by giving them points that they can also exchange by discounts in our products. So we can have a lot of information of questionnaires about quality of life. We can study the behavioral change and the empowerment of the patients before and after using the application, and other studies like recurrence and economic impact using the application. So if you want to make clinical research, please contact us at medicalaffairs@devicare.com. it would be our pleasure to explore collaborations with you. But now you need to know that for now, at the moment, mylit-Control application is only available in Spain since 2 weeks ago. But if you want to be notified once the application is available globally, the probably will be in 2 weeks or in 1 month from now, please scan this QR code. You will find a registration form. You can put your data and you will be notified once the application is available. Nothing else. Looking forward to collaborate with you against the kidney stones, and thank you very much for your attention and for your participation in this symposium. Thank you.